You're watching ABC4 News.
What are the long-term impacts of COVID-19? That's the question. So what's the answer? ABC4's medical correspondent Suraj Chin explains what physicians are learning about lingering symptoms.
There are several symptoms that can arise from COVID-19, and some of those can linger for quite some time. We have Dr. Dixie Harris, a critical care and pulmonary medicine physician at Intermountain Healthcare, and these patients are called Longhaulers, and they're known now as long COVID. Describe some of these symptoms that can last for a long time.
Oh, yes. So there's lots of names for it. The medical community hasn't come up with a formal name, but these patients have a myriad of symptoms. I've seen a couple today. The most prominent symptom they have is fatigue and tiredness. They have everything from headaches to heart racing, shortness of breath. Those are some of the prominent symptoms, but really fatigue is the number one.
What is your most concerning symptoms that you've seen that have lingered for months? Some of them can impact your organs.
Yes. So the primary symptoms I worry about are the pulmonary symptoms, because we worry about pulmonary embolism, and I've seen a couple of patients that have had COVID and then 3 weeks later end up with clots in the lungs. So that's one of them. The other really significant symptoms we worry about are the cardiac symptoms, where the chest pains and the heart arrhythmias that patients can have, pericarditis, myocarditis, so inflammation of the heart, and then they have arrhythmias. But those, in truth, are really rare that we have to treat. But those are the things we most worry about. The other thing we worry about is strokes, mini strokes, TIAs, kind of thing.
Are you finding these symptoms that have lingered, these long haulers, have had prior or higher risk factors to begin with before COVID-19?
Many of my patients actually are totally healthy before getting COVID, and yet they have these ongoing symptoms. I've seen as young as age 15, no medical problems with ongoing symptoms, fatigue. These poor kids, they're trying to do high school online and they just can't think. They've got a brain fog and they can't concentrate for their schoolwork for weeks and weeks on end.
Have you seen this linger longer than a few weeks, maybe a few months? How long are you seeing it?
So I just saw a patient 2 days ago that had COVID in April and is still having symptoms. Much better. What I've seen also, and so this should hearten patients who are suffering from this, is typically the symptoms get better over time. They can wax and wane. I've had patients feel like they get COVID a second time, but it turns out it's just their post-COVID continuing to make them suffer. Typically after 3 or 4 months, the ones I've been seeing, the symptoms are almost all the way done. The patients who are hospitalized, not even the patients who are in the ICU, they're the ones that are concerning, because they actually can have symptoms for even up to 6 months. There was just a study out that they now have 6-month data on those patients.
It sounds like we are learning so much more day by day. Dr. Dixie Harris with Intermountain Healthcare, thank you so much. For more information, you can go to intermountainhealthcare.org.
Thank you. Thank you for having me.